It can be hard to have resistance or to feel like you hit a brick wall and don't quite know what direction to go. I grew up as an athlete, and I was an endurance athlete, so that's what I always think of first, is just how to have endurance, how to train for endurance, how to keep moving forward. My name is Liz Cattin, and I'm the Director of Community Health for Longview and Vancouver. The communities that PeaceHealth serves, there's a high percentage of poverty, and a lot of folks who are living in poverty in our communities struggle with housing, they struggle with access to food, they struggle with transportation. And I remember being on a phone call discussing some of our unhoused patients, and we came to realize that our systems of care are not connected. Patients receive care in the hospital, but when they leave our walls, they truly leave our walls and leave our care until they come back for another episode of care.
That's great. The need is out there. It absolutely is.
The vision for the Community Health Hub really came out of a brainstorm. The goal was to design a physical space for our partner organizations to be on site to make a connection in real time. We know that if they can talk to somebody face to face and make a connection in the moment when they have a need, they're more likely to be able to follow up with that need in the community. In the work that I do with community health, because it is so outside the norm, I heard a lot of the same things that I hear kind of day in and day out, which is, we don't do that. Why would we do that? I think anybody who's seeking to do something different should expect people to say why, and should expect some of that pushback. Exercise has taught me you have to be persistent. You're always reaching for the next thing. For me, it's moving meditation. I'm processing, resetting my brain, resetting my emotions, and using that time truly as time for myself. Endurance is all about showing up. You have to be able to be all in, and you can't be all in if you're leaving pieces of yourself behind.
I call Liz my velvet hammer because she has a way of having hard conversations, listening, and creating a path forward. And she's very patient in helping people along to see that vision. She just never quits. At some point, she accepted the baton from the sisters, and she runs her leg of the race.
So Community Health Hub is open. We've got community health workers in there connecting with patients. We actually just celebrated a year.
She is what made it real. She gave the words to the walls. She inspired the people. She didn't let anyone else give up. Her degree of faith in herself and in our team and our leaders and our community is unwavering. So her persistence is just that she just keeps the faith.